It's time for us to talk health, and in our health segment, our favorite doctor is here, Dr. Kelvin Owusu, and he's going to help us to understand a very interesting topic today: shock. What is shock? Types of shock. What are symptoms and treatment? Good morning, doctor.
Good morning. Did you say what a shock or what is shock? I mean,
what a shock.
Oh, okay. I thought it was one of the posters that, you know, what a shock.
But what is shock?
Well, shock has many definitions. Okay. I mean, in common language, somebody springs a surprise on you and I'm in shock.
Yes.
You know, since it's the love month, your spouse or your beloved, you know, gives you a bouquet of flowers and says, "Oh, I'm in shock." You know, he surprised me. So
yeah, but that one is a gentleman, so it's like it's a surprise.
Yes, yes. You know, but from last week's discussion, some surprises can be, you know, shocking to the point of admission.
Yes.
But medically, when we say shock, we are talking about an inability or not having enough blood to, you know, feed your tissues.
Okay.
Now, this could be literal, as in you don't have enough blood because you've lost blood. Or it could be a function of some form of dysfunction in your anatomy that is creating the perception or the scenario that there's not enough blood, even though you actually have enough blood. So that will bring us to the different types of shock. You know, so the point is, at the end of the day, the blood, whether it's enough or not, it's not getting to the destination.
Okay.
So the body's reaction to the fact that I'm not getting enough blood to where it needs to be is shock.
Okay.
So it's a group of symptoms that are described as shock.
And what typically would put somebody in a state of shock?
Okay, so as I said, there are different kinds of shock, and each of them have different causes.
Okay.
So typically there's been an accident,
okay,
and then you've had an injury to maybe your arm or your leg, and you are bleeding a lot. Once you lose a certain critical volume of blood, it means that the volume inside your circulation is not enough. And so at that point, the body is not getting enough blood to the tissues, to the muscles, to the brain, to the eyes, to all the different parts of the body. And so you begin to demonstrate some symptoms, which we would then say you are in shock or you are going into shock. Okay. And so we would then have to put in measures to remove shock, because a shock is not a good thing to be in, because it's fatal. If it's not, yes, it is. I mean, all forms of shock will lead to death if you don't intervene.
Okay. And
even to an extent, some of them you really cannot do much about it because, well, for instance, if the pump is not working, when I say pump, the heart is not working, that can lead to shock in the sense that the heart is what will push the blood to the parts of the body. Okay. Now, if that pump is not functioning, it means that even though you have enough blood in your circulation, it's not going to reach where it's supposed to go to. And so you're going to have shock. Yeah. Now, if you've had that much, if the injury to the heart is so severe or so significant that nothing can be done about it, then, I mean, you're going to die. So one such situation is what we discussed last week, which would be a heart attack. But not just an ordinary heart attack. It's going to be a massive heart attack, which will compromise the pump action of the heart. Okay. So that's one way that you can actually develop shock.
Okay. Okay. Before you take us into the different symptoms that you know, helps us to know that the person is going into shock or the person is in shock, what are some of the other types of shock that we have? Okay,
so I've actually described two different shocks, but let me just go over. So the first one is hypovolemic shock, where you are literally losing blood. So you've had an injury.
Hypo what?
Volemic shock.
Okay.
Where you are losing blood or you are losing fluid. So when it comes to losing blood, it cuts across everybody: children, adults, male, female. Once you are losing blood, you could get into shock. But then in children, typically, you can also go into shock from vomiting.
Okay.
Because you are losing a lot of fluids.
Oh, wow.
And the blood is filled with fluid. So as you are vomiting, it's going to pull a lot. The tissues are going to now pull. You know, we learn diffusion and osmosis. Yes. So once you are losing fluid through vomiting, you are going to have issues of fluid imbalance. And so there's going to be fluid drawn from blood to sort of try to balance. And as the fluid is being drawn from blood,
you have
the volume
less fluid in the blood.
In the blood. So the volume of blood is
exactly.
So then you'll be going into shock. So children are at risk of this. So vomiting, diarrhea can all lead to shock as well, especially if it's severe. In adults, so somebody who has cholera can go into shock because you are losing fluids from vomiting, from diarrhea as well. So that's also a form of hypovolemic shock.
I see.
Then we have the second one I described, cardiogenic shock, which means that this shock is a function of the pump the pump is not working as it's supposed to. So you can have that as a result of a heart attack, a massive heart attack, or you can have that from an external source. So the lungs can actually impinge or can obstruct the movement of the heart. So we have something we call tension pneumothorax. Again, let's say you had an accident and then there's been a puncture of your lung tissue.
Yeah.
So the air is escaping into the, so just to try and make it a bit graphic, there's a space between your chest wall and the lungs.
Okay.
That's why the lungs are able to expand and contract without causing any pain, because there's that space that allows some movement.
Yeah.
Now there's air escaping into that space. And so as the air is escaping into that space, the heart is also in that space. So that air begins to prevent the heart from doing what it's supposed to do. So that's what we call the tension pneumothorax.
Okay.
And now this could also be blood in that space. So once there's something occupying the space where the heart is supposed to expand and contract, it can prevent the heart from doing its job. Now the heart itself also has a covering. So there's the heart and there's a covering around the heart. And there's a small space between the heart and this covering.
Oh my goodness.
So now, again, I'm using accident because that's what we see. And there was a discussion earlier, so that's the only the thing that comes to mind easily. There might be an accident, something hits your chest, or you're in a fight, somebody punches your chest. It can cause a tear in the heart tissue itself. So now blood or fluid begin to collect in that space. So now that also prevents the heart from expanding and contracting. That's called cardiac tamponade. So that can also can result in shock, because now the heart is not able to perform what it's supposed to perform. Then we have a third kind of shock where there's an issue with the pipes, the blood vessels.
Okay.
This typically can come as a result of infection, or maybe some medication you went to take, which will now cause vasodilation.
Okay.
When I say vasodilation, what I mean is your blood vessels are all open.
Yeah.
So the thing is, there are so many blood vessels in the body, but not all of them are open fully at all times. So say I'm running, I'm jogging.
Yeah.
At the time I'm jogging, I don't necessarily need my stomach to be functioning at 100%.
Yeah.
So the blood vessels that go to the stomach will be contracted. So not a lot of blood is going there, whilst the blood vessels in my legs are open, because I need blood to run or to jog. Okay. When you have generalized vasodilation, it means all the blood vessels, whether the organ is in use or not, are all open. And so when that happens, obviously there will not be enough blood to now supply everybody. And so then you can have a shock as a result of vasodilation.
Wow. This
could come from infection, like I mentioned. So some generalized infection we call sepsis. I mean, you may have come across sepsis. Yeah. That's one of the things we fear most when somebody has a serious infection that can lead to sepsis, because that can result in vasodilation, and then one thing leads to another, and then there's shock. So that's one thing. Some medication can also do that, and so that's why you have to give the right medication at the right dosage to the right person. Otherwise, you can have complications. So that's another kind. So there are several different kinds of shock, and all of them have similar symptoms. It's just that the source or the cause are not the same. The causes are not the same.
What are we looking at in terms of symptoms? What are the things that will let one know that I am going into shock, or the person I'm looking at is going into shock?
So the symptoms, like I said, regardless of what the type of what the cause of the shock is, there are some common symptoms that you'd notice. I think the earliest symptoms you notice would be that your heart rate is increasing. Okay. To try and compensate for the fact that there's not enough blood, as I already explained. Because if the heart beats faster, the little blood you have can be pushed to circulate much faster. So that's why the heart will start beating at a faster rate. Okay. And then you also start breathing faster, so you hyperventilate, because again, you want to maximize the little blood you have. So a lot more oxygen is needed in the little blood to serve all the body parts. So you start breathing faster, your heart will start beating faster to help compensate for the fact that you are losing blood. So those are the first few things you notice. As it progresses, you notice that you begin to sweat. So your extremities become cold and clammy. It's cold because the body will try to contract more blood vessels. Okay. So when I say, so just to put in perspective, on a warm day, when you look at your hand, the back of your hand, you notice that your blood vessels are all very prominent. Yes. That is vasodilation. Okay. It's one of the body's mechanisms for releasing heat. On a cold day, the reverse happens. Okay. The blood vessels will disappear, will go into the skin, so you hardly find vasoconstriction. Exactly, vasoconstriction. And so when you are going into shock, the body tries to conserve the blood, or to maximize the blood volume by shunting. We call it shunting. Shunting blood from non-essential areas.
Yes.
Now, when I say non-essential areas, at the time that you are having shock, your hand is really useless.
Yeah.
So they will shunt blood away from your heart.
Okay.
They will shunt blood away from your kidneys.
Okay.
They will shunt blood away from your liver. Places that are not essential for. They will try and maintain blood in your brain, because if your brain goes, everything goes. So the whole idea of the body's reaction is to maintain blood flow to the brain.
Okay.
So it will pull blood from everywhere. And that is also one of the reasons for the consequences, which maybe we'll talk about later. But once blood is not getting to the fingers and it's prolonged, obviously there's going to be problems there. Yeah. If blood is not getting to the kidney and it's prolonged, you're going to have problems there. So one of the consequences of shock is acute kidney injury. Yes. So and that's what we as medics fear most. Because if your kidneys are not functioning, we are talking about dialysis for the rest of your life, or kidney transplant, which is, it happens in Ghana, but it's not too common. It's not readily available, and it's quite expensive. Even the dialysis is also quite expensive, but transplant is much more expensive currently. And so it's important that we identify these things early. So we've spoken about increased heart rate, increased respiratory rate. We are talking about cold and clammy extremities. So I described the cold, clammy extremities because the blood is being shunted away. So your extremities are cold, and then you are sweating as well. So that's why it's clammy. And then you can become dizzy. You can even fall unconscious. You know, so these are some of the things. Now, specifically for children, this is important because the child will not come and report that my heart is beating faster. You know, so you, the parent, have to be observant. You have to observe that this child the heart is beating faster. The respiratory rate has increased from what is normal. And in children, again, one of the first signs you would notice is that their skin tegel. When I say skin tegel, how the skin, so you pinch the skin. And it returns to normal, but then because they are losing blood, they are going into shock, or they are getting dehydration. Dehydration as a result of vomiting or diarrhea. The skin loses its tegel, so you pinch the skin, you leave it. It takes a bit longer to settle. So if you notice this thing, you don't play with it. You need to report to hospital, because again, the child is not going to report to you that I'm having this or that. You have to be observant. So in children, when you bring a kid to the hospital and the kid is vomiting, one of the first quick signs we would take is to pinch. It's not going to be a painful pinch, but then to pull the skin and see how the skin will return to normal, how fast it will return to normal. And that could even be the first sign. There may not be any other thing. Just by pinching the skin will give you an idea that this child is getting dehydrated. And if you don't act on the dehydration, as I said earlier, it will result in osmosis and diffusion of fluids out of the cells, out of blood into the cells, and then you're going to have the shock. So it's very, very important in children. I mean, I can't overemphasize. It's something that can easily take the child away. So we have to be mindful of that, very, very much so. And once you talk about children, you have to also talk about the other side, the extremes of age. So we have the old people, because they also suffer this as well. And especially now with the setup, how the nuclear family system is interacting with our culture now, a lot of old people are on their own. Just like the way children are unable to take care of themselves, some of the old people are also unable to take care of themselves. And the challenge with them as well is that because they are aging, the fat parts are also depleting. So for them, they can be dehydrated, and you think that it's just the skin that is sagging. So it takes a lot more careful observation, a lot more careful examination to actually pick these things up, so that you can actually intervene and help restore them to fitness.
So I'm particularly curious about the issue of fainting. What happens in fainting? What's going on medically when someone faints?
So fainting is one of the body's ways of correcting this kind of imbalance that we are talking about. So when you are standing, there's gravity acting on your body, which means that the heart has to do a lot more work to push blood up into the brain. And so sometimes there might be a transient. So typical example, you are sitting down as we are, and then you stand up suddenly, an abrupt change in position. If everything is normal, if everything is all right with you, your heart will automatically compensate, and then you just start moving. But you, as an observant person, you notice that if you stand up abruptly, you notice a blurring of your vision, transient blurring of your vision, if you are observant. for most people, it doesn't cost much, and most people don't even notice it. But as you grow older, it becomes more obvious. So that it gets to the time for the heart to compensate begins to increase. And so usually, when you get up like that, the blood to the brain is reduced, and the brain is the most important organ in the body because if the brain dies, everything dies. And so one way of correcting that imbalance is for you to faint. So by fainting, you remove gravity. And so once you lie down flat, automatically the blood is able to now get to your brain, and then it's restored. So that's why most of the time fainting is very transient. You faint or you pass out, and in a few seconds you are back. But when somebody collapses or somebody passes out, becomes unconscious, that's a whole different thing. Because then the person is on the floor but is still not responsive. So that's different from fainting. So when somebody has fainted, it's mostly the body's way of correcting a transient loss of blood or loss of circulation to the brain. That's all it is. So that's why immediately the person falls down. He becomes conscious again, and you can continue whatever you're doing. But of course, it's not something that we should encourage that you should faint all the time. So if it's happening, especially in a young person, we need to find out why is this person fainting so often, because most young people don't just faint anyhow. So if it happens the first time, we would want to know what's going on. Could it be that there's something preventing the blood from going up? So then we'll do a scan to find out what's going on, because it could be the first sign that something is going on upstairs. So we'd have to do a scan to find out what's going on. Is the person's heart beating the right way? So we want to do an ECG to find out if there's any dysrhythmias or arrhythmias going on in the heart. You know, is everything all right? So it's a diagnosis. We need to exclude all the possible causes and then say that, okay, so it was just a transient loss of blood to the brain. That's what caused the fainting.
So how do we treat shock?
So let me start with children. So if you have a child who has diarrhea, there's been so much advertisement about ORS or fluid replacement. It's very, very important that we replace the fluid. We give the person fluid, and now the teaching is that you have to add zinc tablets to it. So give the child zinc tablet because it slows down the diarrhea, and also the English not coming, elongates the interval, so that if the child was getting more diarrhea every 2 days, now it will prolong it, because that's a function of zinc. So that's why zinc tab is very, very important. If the child is vomiting and cannot tolerate any food at all, you have to bring that child to the hospital. Don't try to stay home with that child and do all the home remedies, because if the child is vomiting, it means you cannot feed the child by mouth. And in the very young, in the extreme young babies, 1 month old, the first 6 months, who are exclusively breastfed, if you try to feed that baby whilst the baby is vomiting, or you might actually get an aspiration, and that's another issue. When I say aspirate, it means the food will end up in the lungs, and that's another big deal. So if the child is vomiting and the vomiting is uncontrollable, you have to bring the child to the hospital immediately. In the older people, if you are vomiting, obviously you know what to do. Again, if it's serious and uncontrollable, you have to come to the hospital so that we can do a fluid replacement. If the shock is as a result of blood loss, say you went to an accident scene, or you yourself were involved in an accident and you are bleeding, and it's profuse bleeding, your first thing is to try and slow down the bleeding. So put pressure. Now, here, there's always a challenge, and the emergency people will tell you that there's always it's dicey, because most of the time people will tie the limb. Now, when you tie the limb, yes, it can help slow down the blood, but it can also complicate the thing by cutting blood supply to the rest of the limb. You know, so in trying to slow down the blood circulation, you end up compounding the thing, because once you cut blood supply, you are going to have a dead limb on your hand. And so it's a difficult position to be in. Thankfully, now we have a lot of ambulances available, and so we need to call the ambulance number and get them to come in immediately. But whilst waiting, just apply pressure, a lot of pressure. You can what's it called? Get a clean cloth or clean dress, roll it up, put it on the site of the bleeding, and then put something over it as much as possible. But make sure, and this is a bit technical, but make sure we say there's a pulse distal to where the injury is. So you have to feel for pulse, and feel for pulse is something everybody needs to learn how to do. The common one is when you put your hand here, you actually feel your heart beating here. But there are other places that you can actually feel for pulse, and on top of the foot, behind the knee, you can find the pulse there as well. So we need to learn how to do all these things so that we don't compound the situation. But when the person is bleeding, try and stop the bleeding any way possible, and get the emergency people to also come in and then do what they need to do so that we can prevent the person going into shock or the person losing that limb as well. The other causes of shock, like the cardiogenic ones I mentioned, it's difficult to do much about that at home. you'd have to get to hospital as soon as possible, because if the person is having a heart attack, there's not much you can do in the house. However, there are some people who have had heart attacks before, and they've been given some first aid medication that they can take in the event of a repeat or another heart attack. So they would know because they've been there. But these are not things that you can just walk into a pharmacy and buy and keep because you're anticipating a heart attack for yourself. It doesn't work like that. So you need to know. Once you notice that you have pain, like we described last week, pain in your chest, which is radiating to your jaw or to your left arm, you have to quickly get to a hospital near you. Very, very important.
Okay. How does one treat shock once we find that this is what is happening? The symptoms all look
the same.
Like it's shock.
Okay. And thank you for bringing that up, because I left something quite important. Now, remember that I said that the most important organ is the brain.
Yes.
So when the person goes into shock, most of the time you realize that we elevate the legs because you want to get blood from the to flow back towards the brain. So when you when you notice that, even when you have prevented the blood from the person from bleeding, it's always good to elevate the legs. So find, if it's on the street, find a stone or find a bag to put the person's legs on, so that the legs are higher than the heart, and that would help return the blood. Now, when they do get to the hospital, the treatment basically is fluid replacement. So we immediately get to the hospital, they determine or they assess and realize that you're going into shock. They will put a cannula and then start a drip. Okay. So they will start giving you fluid. If it's blood that is being lost, they have to replace with blood. And so they will request for blood from the blood services, and then they will give you some blood, which is also why it's important that every Ghanaian must be a blood donor, because you don't know when you need blood, and then they can't find blood. So it's very, very important that we have enough blood in the blood bank. Very, very important. In children, same thing. The difference is that in children, everything needs to be calculated very, very well, because you cannot, a child of 1 month and a child of 6 months, they are all children, but they are very different by weight, by age, and all that, and their handling of fluid is much different. So the fact that the child is vomiting plenty doesn't mean that give the child plenty fluid. It's important that you give the child enough fluid, or the exact amount of fluid that they need, and there are calculations that need to be done. So that is why, again, you must go to hospital, because you can't do it yourself. At home, what you need to do is give ORS if the child is not vomiting. If it's just diarrhea, give ORS to replace the fluid loss. If ORS is not working, the child is not willing to take the ORS, it's better you give juice than water.
What kind of juice?
At this point, any kind of juice, so long as the child will take the juice. So fruit juice, whether it's fresh fruit juice or box juice, it doesn't really matter. But not water, not plain water.
Why not?
Because plain water will sort of cause a dilution effect. And what I mean is the plain water will get into the blood, all right, but then because the child is losing fluid, the body or the cells will pull the plain water much faster. So you end up compounding the situation you're trying to resolve. So you kind of need the fluid, that is the water that is bound to other stuff. So that's why you give the child juice. But ORS is number one. If the child, and now thankfully there's flavored ORS as well. So yes, so now we are actually in a better. Back in the day when we were growing up, in fact, I don't think I ever finished a glass of ORS. It was terrible. But now there are flavored ORS, which is helping. But if the child is still not taking the ORS, then your next line is juice. But not plain water. If the child is breastfeeding, even better, just give breast milk. So if you are going to feed the child continuously, do it. Because that fluid, the child needs the fluid replaced as quickly as possible. It's very, very, very important. All
right, great. Now, two things from my own personal experience. When I was, I think, 14 years old, 13 or 14, somewhere there, I was sweeping the compound. And at the point, I had been bent over for a while, probably, I don't know, estimating maybe 5 minutes, just sweeping. And then I stood up, and all of a sudden, the whole world went black. For maybe, I don't know, 2-3 seconds. Everything went black. Now, I didn't fall down. What happened was that I had a sense to come back down, and then I put my hands on my knees. So I literally just dropped the broom, and then I put my hands on my knees, and just until it just sort of passed. What on earth happened?
So that's what I described, that similar to when you sat down and then you just get up abruptly.
Okay.
So the technical term is orthostatic hypotension.
What was that?
Orthostatic or positional hypotension.
Okay.
So the most common that you find is actually from sleeping. So you are lying down and then maybe you wanted to go and pee. So in the night you woke up and then the pee was coming. So you woke up and you just jumped and you started going.
Quickly.
You would get that same thing. So because you had bent down for a while, and once you bend down, because your heart is now down, so gravity is minimal. So once you stood up straight, the distance from your heart to the ground increased, and obviously gravity now started acting. Okay. So now the blood going up suddenly had to
pressure
come down a bit, and the heart had to adjust by pushing more blood to sort of restore the balance. And so that's why you had that dizzy spell a split second. And once you went back down in the bend down position, again, you minimize gravity somewhat, and so it was able to restore the circulation. So basically, as you grow older, you shouldn't do any fast movements. You should take everything
a little slow.
You know, enjoy life some more. Take it easy.
But it's interesting because I was just 13.
Yes, it happens. It happens. You see, it happens to everybody. However, most people don't notice it because they are healthy, they are fit, their heart is still in good shape. So the reaction time is quickly. But right now, if you were to get up abruptly, you would notice it will be a fleeting, like a passing thing, but it is there. But it's not obvious. But as you grow older, everything else also grows older. So your response, your body's response also becomes slower. And so that's why it becomes more obvious as you age. You know, and so as you grow older, there are things that you used to do that you are not supposed to do the same way you were doing them. You have to know the times and act accordingly.
Interesting. Interesting. As you grow older, everything else also grows older.
Exactly, and becomes slower.
Deep saying. The other one is when we were kids. At a point, there wasn't ORS in its normal, in its package form that we have now. So one thing my parents used to do, and I remember this very, very well, and I don't know who gave them the idea, but I mean, they've always had doctor friends and all that, so it's possible that it was suggested. But there was Fanta and Coke mixed together with salt and sugar.
Okay, so ORS it's oral rehydration salt. At the most basic level, it's simply water, salt, and sugar. So you can actually create or formulate your own ORS. Now, sitting here, I don't remember the specific ratio, but I know that it's 6 spoons of salt to 1 spoon of sugar, or something like that. You just mix it with warm water, and you are good to go. So now, Coca-Cola, Fanta, there's already a lot of sugar in there. So you can actually just pick Coca-Cola. You don't even need to mix it. Just Coca-Cola, and then you add salt because there's a lot of sugar in there already. So you add your salt, and then you have ORS that tastes a bit good. You know.
So you can easily make ORS to treat
yourself. Yes.
If you just pour Coke into a glass, add salt to it, and you're good to go.
And you're good to go, really, because there's already sugar and water in the Coke, and then the salt is what is missing, so add your salt. But once you add salt to Coca-Cola, it's going to fizzle a bit more, so prepare for the mess. So you probably need a much bigger cup so that it doesn't overflow too much, because you need to drink it fast, because it doesn't, the taste is some way.
Well, yeah, I mean, it's not nice. Any soda... that you add salt to it.
So whether Coca-Cola or Fanta, the sugar is already there. So you're just going to add your salt to about half teaspoon of salt to your Coca-Cola, and then you have.
But you can use any regular sweet drink.
Yes, you can. You can. It's just a mixture of sugar and salt. Like I said, you don't want the plain water, because plain water will compound the situation. So you want water that is bound to something. So the salt and the body needs the salt, because again, the salt in the blood will also try and counteract the osmosis that is going on. The movement of fluid. So it will try and balance it out so that it will stop.
Thank you.
But if you do that and it's not working, you have to report to the hospital. Your readiness to go to hospital should increase if the person involved is younger or much older. So when you have extremes of age, you need to be more ready. Like, you need to be prepared to go to hospital much quicker. because their symptoms can be masked, and by the time it shows, it's quite serious or severe.
Right. Okay. Thank you very much, Dr. Kelvin. We've been speaking with Dr. Kelvin Owusu, who is the medical director for Optimacare Diagnostics, and he's helping us to understand what shock is, the different types of shock, the causes, symptoms, and the treatment.
Hi, I hope you enjoyed the show. Do not forget to subscribe, like, comment, and share with your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.